Hi, my name is Dr. Ed Shahady, and we're here at the Cardiometabolic Risk Summit in Las Vegas. And I'm joined here by Dr. Kevin Peterson, who's a professor of family medicine at the University of Minnesota. He just gave a fascinating talk on diabetes, the beta cell and diabetes and the beta cell survival, because we've always thought the beta cell, you know, it's dead. You can't do anything to help it. So, Kevin, are there drugs, lifestyle things? What should we be thinking of? Or is beta cell survival just a myth? It's not real.
I think it's an increasingly important consideration, both in the initiation of medicines and in the prolonged treatment, the durability of our medicines. So I think it's really important for us to think about the beta cell and preservation. We know that we know that most of the drugs that we use, they treat diabetes for a little while. They lower the A1C, but beta cell destruction continues on. It's not that the beta cells don't replicate. They replicate at just as fast in a person with diabetes as they do in a normal person. It's just that cell death overtakes that replication, and they eventually lose their beta cells. So if we can allow preservation of our beta cells, I think it allows a great deal. It helps us a lot. It helps us when we start insulins and things like that. It helps a person with some beta cell function when they start an insulin has less hypoglycemia. But it also affects what other medicines we look at, and it affects the way we prevent diabetes. No, I think it's an important concept.
Well, you talked about some medicines do it more than others. Like we know from, UKPDS, you use sulfonylureas and metformin, you eventually, they're going to need something else. So maybe they don't preserve the beta cell, but some of the newer drugs maybe do, and insulin maybe. So you want to talk about that? Which drugs do, which don't?
Sure. I think that, there are a lot of drugs that say that they prevent diabetes, but most of them don't really preserve function. Most of them, you take away the drug, and the same number of people have diabetes. So it's not really about prevention, but there are a few, and I'd say the incretins right now, the GLP-1s, the work with exenatide right now is very exciting. When people are on exenatide for a year, well, they lose weight and they get control of their A1C, and then you take them off and they start gaining weight, and it's only as long as the duration of the year. But if people have been on it for 3 years, then their beta cells are actually better than they used to be. If you put a person on glargine or insulin, basal insulin for 3 years, their beta cells continue to decline in their function. So I think it's a major difference, is that most medicines, the beta cell death continues. In some of these new medicines, it actually starts improving.
Very good. We appreciate your being here, Dr. Peterson. This is outstanding. It's good information.
Well, thank you.
Thank you. Enjoy the rest of your time at the Cardiometabolic Risk Summit.
Well, thank you for inviting me. It's been great. It's a great conference. I really like it.
Good.